Welcome to Benita's maternity program antenatal class. Today we're speaking with Sister Talia, who will be chatting to us about sleep during your pregnancy. Welcome, Sister Talia.
Hi, everyone. Good morning. So this is a very important topic, mainly because I get a lot of calls from moms asking me, Sister, I've noticed that I am not able to sleep or I'm too uncomfortable. And then I usually go through these little clips with them on the telephone to just kind of get to the point of why you're not sleeping and also how can we help you. So during sleep, during pregnancy, our body's sleep pattern changes. So why is this happening? The reasons why it happens, we're going to look at today and how can we treat it. So what is one of the reasons? We can say our body function changes. So it may be due to hormonal changes. There's a lot happening during pregnancy with our hormones, and it will affect our sleeping pattern. It may affect it to insomnia, which is the inability to sleep or falling asleep. It's difficult. To overly tired, sleeping all the time. So some pregnant mommies will call and say, Sister, I'm always sleeping. And others will call and say, I can never shut down. I can never fall asleep. So we look at some of these things. We may have sleep disruptions due to underlying health issues, such as heartburn. So a lot of moms suffer from severe reflux or sour things coming up. And this can keep you awake because you have to sleep in a different way. And that can be very uncomfortable. Then we look at things like hypertension. That can also have an effect where it makes you feel overly tired or overly awake due to medication you may be on, similar to gestational diabetes. So then we also look at our preeclampsia. Preeclampsia, we know it's a condition during pregnancy that we have had the high blood pressure, and that is then something that can go further to preeclampsia. And this is also a kind of a thing that can alter our hormones, alter our moods, and it's a lot for our body to tolerate with medication. We can have back pain and body discomfort. A blocked nose, such as sleep apnea. So when you're sleeping, you stop breathing in between. So that is a bit different to a blocked nose. So a blocked nose will be, just the sniffles, generally not feeling great breathing-wise. But then when we look at sleep apnea, it's actually ceasing breathing, then rebreathing again. And that causes a lot of disruptions, very tired mommies or even people waking up in the morning. Then we have some restless leg syndrome. This is very important to note because with our restless leg syndrome, it feels like your legs never shut down. It's moving, and you have to move. Antenatal depression, that's a depression during pregnancy. Then we have a postpartum depression. This is after pregnancy. A restless leg syndrome, as I mentioned earlier, we have the overactive bladder and frequent urination. And why we mention it twice, that restless legs, we have two different ones. We have moms that has continual cramping legs. That's different to restless legs. Restless legs is like a muscle twitch, it's just moving, and it obviously keeps you awake. With cramping, it's like in that muscle, it's so uncomfortable. So you feel actually like you can't lay still. Some moms need to move to get that cramps away. Some moms like kind of, they just can't shut down. If you have any discomfort, you can't shut down. And then overactive bladder. So I know all pregnant moms knows about this. So you just had a wee, you go back to bed sleeping, then you have to run again. Then we have anxiety. This happens a lot. We as women, we make little mental notes as we sleep. So we have anxiety of thoughts. What will labor be like? What will motherhood be like? What type of mom will I be? Did I get the right cot? Did I get the right pram for the baby? And then we have energy. Some energies are quite low. Increased fatigue can be a reason for this. And then we have vitamin deficiency. So both are similar but different, because vitamin deficiency could be due to a lot of vomiting in pregnancy. And this mom may feel tired all the time, or anemia even during pregnancy, where she needs extra supplementation. So we were looking at our next part, and that is what to do. with all these list of conditions, I know you're thinking one of it you're identifying with. I know I've seen a few and I'm not even pregnant. And this is some of the reasons why we wonder why we're losing so much sleep and feeling tired all the time. Or we just want to sleep, okay? So can this harm my baby? Not necessarily, moms. However, baby is unaffected by you not sleeping. Baby sleeps. If you're awake, baby sleeps. They have their own little schedule in the tummy. But it may make you cranky, tired, inability to function. You cannot enjoy your pregnancy, or even just finishing off on your last bits of work before maternity leave, or just your general well-being. It suffers a lot with sleep deprivation. So what do we do? I always say to mom, good sleep hygiene. And then they laugh and they're like, hygiene. Yes, it's similar to us having a hygiene before work, for instance. We will wear clean clothes, wash ourselves, so we'll be clean and our bodies will be clean and our clothes will be clean so that we feel fresh for the day ahead. And that's the same for sleeping. We need to get ready for that time. And the same is needed. We need to get ready for bedtime, and there's certain things we can do to just help that effort of sleeping. So, firstly, and this I can't stress enough, I have to tell myself this regularly: sleep when you're tired. I know there's a million things to do and things to think of, but don't overbook yourself in terms of your weekends, commitments. I know pregnant moms have a lot of things, family wants to see them and have some time with them before baby comes. Your partner wants to do certain things with you before baby comes, go for a walk, this and that. But if your body is telling you, shut down a little, I am tired, I want you to take the rest, take it, okay? And this will also help you sleep overall better, because if you're overtired, it's difficult to fall asleep. And then we have exercise often and go for slow, safe walks. So no mountain climbing, no rigorous things, unless you're expert mountain climber, and that's what you've been doing for 9 months. But most moms, it is dangerous because rocks can slide, your foot can slip, you can fall. So those are the reasons why we don't say, rigorous things. But safe walks around the block, it really releases that endorphins. I can't stress it enough. I have to always tell myself to go for walks as well, because it overall makes you sleep better. And it actually, we're not doing gymming, we're not exercising to lose kilos, but we're doing it for our mental health and to help us sleep. And then we're looking at sleep apnea. So a blocked nose we can treat with some saline during pregnancy, especially during this time we have our heaters on, our fans on. Those are things that can actually be uncomfortable, so you can put some saline in. However, if you have sleep apnea, where you actually have this tendency to stop breathing, breathe a bit, it does make you exhausted in the morning because your body hasn't received enough oxygen. There's certain machines for that and testing that you can do after pregnancy. The reason why sleep apnea is common in pregnancy is because that little valve, it wears a bit out in pregnancy where it becomes weaker, like the rest of our bones and everything. We have a relaxing hormone called relaxin over our body. So I always tell moms, after pregnancy, check it out, but now make your bed, elevate it a bit, even putting a brick underneath it, extra pillows or anything. Those are all things that can actually just help you recover in terms of your blocked nose and with your apnea. So higher up, elevating the bed top. So a brick works wonders. Moms have said it's better than any devices they buy. Ensure the room is not too warm or too cold. So if you're using a heater, have a humidifier, because otherwise you're going to have this blocked nose, or have a little small bowl of water. It really helps keep the air moist, and it will help you sleep better. Otherwise you're going to have this twinkling cough all the time as well. And now we're at our next point. Ensure you are stocked up on pillows. For point 2, which is the apnea, for anything, pillows does it for a pregnant lady. I know you get the pregnancy pillow, that may not even be enough. So it feels like your partner has this little piece of bed and you just have pillows everywhere, but you need it. It makes you comfortable. So put some in between your legs if you have some back pain, some on your side, put some under your tummy, because sometimes the weight of the stomach, if you're laying on your side, is actually quite overwhelming. So just putting a pillow under your tummy, especially in the later times of pregnancy, like here from 30 weeks onwards, your body and your tummy may be quite big and sore. It can be quite painful during the night, which can keep you awake. And then have it under your legs as well. Side sleeping is preferable, as sleeping on your back actually diminishes your blood supply to baby, which isn't good, great for you or baby, but it also is not great for your ergonomics of sleeping, okay? So then we're looking at winding down. Now, I know this is difficult, but before bed, we need to have a time we set to ourselves. Where devices are off, we work this packed away. There has to be a scrolling time stop. And I know we say this for kids, but it's actually just as necessity for us. So social media can aggravate insomnia, where we're scrolling and strolling and we're saying, oh, I wanted to still check out this one pram and check it out compared to the other one. What's the difference? And we're laying and we're reading, but that's not real reading. That is keeping our mind awake as well. So we are struggling to then fall asleep. So have a shutdown time when nothing is Googled, nothing is searched, it's off time. And then start wind, and then a warm bath. So I love Epsom salt. I always recommend it to my pregnant moms. It's safe, it's affordable, it has no added preservatives in, nothing in. Add a scoop or two in your nice warm bath. It really relaxes you, especially for those that's struggling with sleeping. But I do know some moms cannot bath because they're prone to infection. Then don't do that. Have a warm shower, okay? The warmth is actually the thing that will help you settle and sleep. And then a weighted blanket. So we've heard it's quite a buzz thing in America and overseas to do this, but a blanket that has a bit of weight, it's been known to actually induce sleep and help you. But I really think it's the warmth of everything. So, just keeping your temperature control quite well, it will make you settle down quicker. A cup of rooibos tea, it calms you and it also soothes the throat, especially moms that have some sleep apnea, blocked nose, trickling of the throat. It's that season as well. It really helps. Soft music or background noise. And we always say this for little babies, but sometimes we need some white noise in the background in order for us to sleep. There's great apps available now, so there is really no shortage of finding the apps. And then avoiding too much food before bedtime. So most pregnant moms, especially at this from 30 weeks onwards, they don't even feel like sitting up to eat in the kitchen or anywhere. You just want to get to bed. I've been there. You just want your McDonald's on your lap and eating it. But it does weigh you down. And later on, you're actually going to have a very restless night's sleep, waking up often, uncomfortable. So avoid eating too close to bedtime because it will also aggravate your reflux. And then we're sitting with like helping one thing, but another thing is not working. So then we have switching off the light at a reasonable time. That's similar to devices, but the actual light of the room. Eskom is helping us a lot with that one. But just make sure you put it off before they put it off. Otherwise, in the middle of the night, you have these lights going on and being on. But that is very important, shutting down. I can't stress it enough. Reading, it does help. It calms the mind. Reading a parenting books, it eases your anxiety as well. Being prepared, preparation is always key. So reading all these things, making sure that you're ready. What questions you have, instead of Googling it, get a great pregnancy hardcover book from front to back. And every night, make it an effort to read one page. Don't go overzealous. You can't, get anything in reading 20 pages a night. But just one page a night, and I promise you, either if you're very tired, you'll fall asleep while reading those pages, or you learn something great. So what else to do? Continuous anxiety is a big, big thing. Talk to a professional and also talk about how you feel. If it's to your partner or to a family member or a friend, reading about certain topics regarding pregnancy can help you, but it can also increase anxiety. So that is very important to deal with it because it keeps you up. At the end, a baby wants a mommy to be happy and enjoying baby, not necessarily have the best pram or the best devices ready for baby. So that's very important to note. We want you to be happy and to enjoy this very precious time in your pregnancy. And never nap too late. This is actually a big thing for those moms that's overtired again and sleeps all the time. So moms always phone me and say, is it normal? Am I okay? Sleep. If you feel like sleeping, go to sleep. As long as you're not sleeping to kind of get away from the experience, or that you feel you are pregnant, but you are feeling like, you know what, I'm feeling very, very uncomfortable, and I'm not feeling this, I'm feeling depressed, that's why I'm sleeping all the time, then you also need to speak to somebody, okay? And frequent urination, try to empty the bladder at least a while before bed, and make sure you have less fluid at bedtime. Backache, pillows, 2 Panados every 6 hours, not exceeding 2 days. Otherwise, you'll end up with some constipation, which also will keep you awake. And a heat pack on the back, never the front, because we don't want to burn the tummy. It's very uncomfortable having a burn during pregnancy because there's nothing we can give you for pain. And then restless legs. So we have supplements that is available that's safe, like your calcium, magnesium. Leg cramps, you have Slow-Mac Fizzy that you can take once a day, usually in the evening, and that will help that cramps, and really it really keeps our moms awake. We have a lot of calls about it, and it's something as simple as taking something fizzy in a glass of water every night that can actually help you. However, we are just recommending help in terms of things we can control, such as temperature, the room, etc. Sometimes medication is needed. I do not recommend over-the-counter medication to moms. Over-the-counter medications just ends up really, really being dangerous to mom and also to baby. But if it happens that, sister, I've tried all these things, I've had your warm bath, I've switched off, but I cannot shake this feeling of anxiety, or I cannot shake the feeling that I can't sleep, then there is medication available, okay, that can help you. However, if the problem should worsen, so this is very important, sleep deprivation can actually just aggravate feelings of depression or anxiety. So I always tell moms, as the days go on, please consult with your doctor so he can prescribe safe medication. I hope you get some good shut-eye, moms. You need it. So when baby comes, you have good shut-eye in, and you have all the energy for your new baba.